COVID-19, best practices for people who use drugs. Wash your hands for at least 20 seconds with soap and water every time you come in contact with others, after handling money, and when you get your drugs. Use hand sanitizer if soap and water is not available. Avoid touching your eyes, nose, or mouth. If you have symptoms of the virus, such as fever, dry cough, or shortness of breath, do not go to the syringe access site. Call or text Tapestry, and they will deliver the supplies to you. Stay at least 6 feet away from others. People with diabetes, asthma, and hypertension are high risk. If you must sleep in close contact with others, avoid face-to-face sleeping. Always cough or sneeze into a tissue or your elbow. Throw the tissue away and make sure to wash your hands. Wipe down drug packages with alcohol-based cleansers as soon as you get them. Do not store drugs in your mouth, vagina, or rectum. If you have to, be sure to clean packages thoroughly before using with alcohol-based cleansers. Do not share cigarettes, joints, pipes, bongs, vapes, e-cigarettes, or any injecting equipment. If snorting, do not use money or used paper. Use a new straw, and if using with others, use color-coded straws. Prepare your drugs yourself, and don't allow anyone else to touch your equipment or drugs. If you cannot do so, stay with the person who is, and make sure they are washing their hands. Make sure you wash your hands and surface to prepare drugs thoroughly before using. If snorting, crush drugs as fine as possible to avoid damage to the nose. Use a clean item to crush the drug, not credit cards or licenses. If your injecting equipment is no longer safe, snort, swallow, smoke, or insert the drug into the rectum, also known as booty bumping. In case your dealer gets sick, plan for opioid withdrawal by stocking up on over-the-counter medications such as ibuprofen, Pepto-Bismol, and Imodium. Try to have protein-based drinks and electrolyte replacements such as Pedialyte and Ensure available. Make sure to have a backup drug supplier. Don't be afraid to go to the hospital for treatment. Alcohol withdrawal can be dangerous and even deadly. If you are dependent on alcohol, try to keep a steady flow of smaller amounts of alcohol to avoid withdrawals. Stock up on alcohol, but avoid binge drinking. If possible, stock up on drugs and drug-using equipment to last several weeks. Avoid binging. Plan and prepare for overdose. Make sure you have enough naloxone. Lower your risk by going low and slow. Stagger use when using with others. Do not use alone, but if you have to, make a safety plan and be sure you call or text someone so they know and can get help if needed. Store a breathing mask in case rescue breaths are needed. COVID-19 makes overdose prevention a little harder, but it is still possible. You can obtain supplies from your local syringe access program that will help to keep you safe. If you are on medication-assisted treatment, ask your provider about take-homes. Buprenorphine can now be started using telehealth. Ask a counselor at Tapestry or your healthcare provider for more information. If you are in recovery, use online meetings and groups for support. Be sure to check out these resources to help you through these challenging times. Together, we can help to keep everyone safe from COVID-19.